National Autism Center found it important to publish the Parents Manual to provide parents with accessible information regarding an extraordinary scientific undertaking, and that was the National Standards Project. The National Standards Project was a large systematic review of treatment literature looking at effective treatments for individuals on the autism spectrum. And this manual was written specifically to provide parents with information regarding that scientific undertaking. We think that the parent manual is easy to read and accessible to parents because we had professionals co-authoring the chapters with parents. And so the information is provided in such a way that they might be able to use it to communicate with teachers or other professionals that may be working with their child. Evidence-based practice refers to a three-pronged approach to developing a treatment protocol for individuals on the autism spectrum. The term was taken from the medical literature, and the three components which make up evidence-based practice include professional judgment, quality science, and the values and preferences of the family members and the individual on the autism spectrum. Evidence-based practice is important for families to ensure that their child is receiving the highest quality intervention or treatment from the professionals that are working with their child. We lay out in plain language characteristics of the various autism spectrum disorders as well as conditions that might co-occur with an autism spectrum disorder. I think this manual is different than other resources for parents in that it provides them with definition and understanding of evidence-based practice, as well as a detailed description of the 11 established treatments and 22 emerging treatments that we identified in the National Standards Project. There are so many treatments out there for parents to consider, and at the National Autism Center, we'd like parents and professionals to take into account the 11 established treatments prior to looking into other treatments that might not have the high-quality scientific evidence to support them. We devote an entire chapter to data collection because it's really important to successful treatment programs. The way I explain it to parents is we start out by outlining specific objectives for a child, such as eating dinner with the family, or saying their name, or spelling out a certain word. We want to collect data throughout the treatment process to make sure that the child is successful in achieving those objectives that we've outlined. It also allows us to determine whether or not we need to make any changes to that treatment program so that we're programming for success. Family preferences and values can encompass a whole wide range of things, from religious practices to dinner time to leisure time. Each family is different, and we have to take these things into consideration. For example, in some cultures, it's not appropriate for a child to make eye contact with adults. And a number of practitioners often begin a treatment protocol by teaching a child on the spectrum to make eye contact. And so for some families, this isn't appropriate. That's why practitioners need to take preferences and values and the cultures and beliefs of families into consideration. We recognize the challenge that parents face in identifying professionals who specialize in the treatment of children with autism spectrum disorders. Therefore, we outlined a number of factors that parents should consider when looking for professionals to work with their child. There's a saying that when you've seen one child with autism, you've seen one child with autism. So we think it's really important that parents identify professionals who have great experience in treating a number of different individuals on the autism spectrum with a variety of ages and different functioning levels. We recognize that parents face a number of challenges on their journey with their child on the autism spectrum. We're hoping here at the National Autism Center that the Parents Manual provides them with the tools to ensure that their child has a quality treatment program. This will allow their child to reach their full potential and be the best person that they can possibly be.